Good morning and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast series, once a week, we bring to you news and views about public health, infectious diseases, vaccines, and vaccination. I am Schmitt, and with me, as always, is Dr. Melvin Sanicas. Good morning to Switzerland. Good morning, Melvin.
Good morning, Professor Schmidt, and good morning, good afternoon, or good evening to those who are watching or listening to us today.
The topics for today are long COVID and the SARS coronavirus 2 spike protein and how they can cause brain damage or brain disability. The connection between COVID and cancer regression, that is very interesting, that infectious diseases can reduce cancer. Melvin will speak also about meta-analysis and the high-risk Epstein-Barr virus lineage causing nasopharyngeal cancer in China. I will cover the OROV virus causing stillbirth. I will cover Legionellosis, or actually Legionnaire's disease. And finally, the return of tuberculosis after the SARS coronavirus 2 pandemic. And that is returning, tuberculosis is returning. Having said this, I think, Melvin, you can start with the spike protein and how it causes damage to the brain.
Yes, so this is really an interesting study. So we know that the SARS-CoV-2 spike protein is really one of the most important things that we have talked about, especially in the early part of the pandemic when we didn't have a vaccine. But now this study is showing us that SARS-CoV-2 spike protein remains in the meninges and the skull's bone marrow for years after infection. This is potentially causing chronic brain inflammation and increasing the risk of neurodegenerative diseases and accelerated brain aging. So the team developed an AI-powered imaging method to visualize spike protein distribution in 3 dimensions. And they revealed previously undetectable accumulation in tissues, enabling deeper insights into long COVID's impact in the brain. And what's also interesting in this study is that they were able to see that mRNA COVID-19 vaccines, particularly the BioNTech Pfizer vaccine, significantly reduce spike protein accumulation in the brain and surrounding areas by around 50%. Potentially highlighting their protective role against long-term neurological effects. And also, I think what's really important in this study is that it really suggests using accessible tissues like the skull's bone marrow for diagnostic purposes and developing biomarkers and targeted therapies to manage or prevent long-term neurological impairments linked to COVID-19.
So this is another new theory to explain long COVID and long-term COVID effects. And this is sort of a surprise. Usually I would assume a virus enters the body and then it is destroyed and basically the proteins are digested, but that may not be true then for the spike protein, right?
Yep. So this is one of those hypotheses, but again, it's related to inflammation.
Very nice. Or yeah, a new theory on long COVID and brain effects after SARS coronavirus 2 infection.
Yep.
Melvin, you have another story, and that is sort of amazing because cancer regression following coronavirus infection. So explain us what the observation here is.
Yes, so a new study by scientists from the Northwestern Medicine Thoracic Institute published in the Journal of Clinical Investigation showed a connection between COVID-19 infection and cancer regression. And this is when the scientists in this study observed that the RNA from SARS-CoV-2 triggered the development of unique type of immune cells with anti-cancer properties. And these cells, they call the INCMs, or the inducible non-classical monocyte, were found to attack cancer cells and could potentially be harnessed to treat cancers that are resistant to current therapies. And these findings possibly explain the mechanism behind the reported regression of certain cancers, not all cancers, only certain types of cancers following COVID-19 infection. So this study used both human tissues and animal models and found that these unique immune cells could be pharmacologically stimulated using small molecules, potentially creating a new therapy for cancer patients. And the discovery could also have significant implications, particularly for patients with aggressive or advanced cancer who have exhausted traditional treatment options such as immunotherapies. The investigators in this study discovered that during COVID-19, a special subset of immune cells can be stimulated in the body, and this is what they call the INCM, or the inducible non-classical monocytes.
Very interesting. So, number one, there is an observation that a infectious disease is associated with the regression of a cancer.
Mhm.
And then they observed this, and on their search for an explanation, they found this new cell type that, after a COVID infection, reduces the size of cancerous cells, correct?
Certain tumors, yeah.
Very interesting. I had COVID 6 times, and I had several vaccine shots. I think I just got number 7 a couple of weeks ago. So, maybe I should have waited with my COVID shot and get some mild COVID to fight any cancer that may be in my body at this point. No, on a serious note, I think very exciting what these researchers did, from an observation to an explanation, right? This is really good research. Nicely done. Yeah. Very good. All right. I have now another one that you present on EBV. And again, it's on cancer and the association of a certain lineage of this EBV and nasopharyngeal cancer. What is the story here?
Yes, so researchers at the Li Ka-shing Faculty of Medicine at the University of Hong Kong discovered a significant association between specific Epstein-Barr virus, EBV, variants in a nasopharyngeal carcinoma specific type in southern China, where it is 20 times more common than in non-endemic regions in the world. And so the findings provide the basis for further scientific research and have the potential application to population screening and diagnostic tests, and also potentially for a vaccine in the future. So NPC, often referred to as Cantonese cancer, affects predominantly 30 to 60-year-old men in southern China, including Guangdong and Hong Kong and Southeast Asia. And they were just looking at all these different study, and of course this is a meta-analysis, but they were able to see a very strong link between a specific variant of the Epstein-Barr virus and nasopharyngeal cancer in southern China.
So the challenge is now to identify the differences between the relevant differences with regard to nasopharyngeal cancer development between this specific lineage in southern China and EBV in other parts of the world, where nasopharyngeal carcinoma is not or rarely associated with cancer.
Yep.
And that is the work that they're doing now, I guess, right?
Yes, right. That's the next part of their research, yeah.
So basically, they have a very interesting finding, which is highly relevant, and now they ask for research money, right? This is the usual thing. You have an idea, you have an observation, and then you prove it the best way you can, and then you ask for research money to study this in a little bit more detail, to understand why that is and come up with a solution. Very nice.
Right.
Another nice piece. Thanks for these 3 interesting topics that you brought us today, and I think it is highly relevant for the future of medicine.
Yes.
I have a not so good news piece, and this is about one of my favorite viruses since this year. It's the OROV virus, which is causing outbreaks, or actually epidemics, in parts of Latin America. And it used to be limited to some villages in the Amazon region, but now it is more widespread in Latin America. I'm not sure if it was not present before, but nobody had a test and nobody knew this is OROV. And now, I guess, with available tests, now everybody finds the OROV virus. Usually the virus causes mild fever, a little bit of myalgia, headache, and, unspecific symptoms, occasionally neurological symptoms or brain disease, and even some fatalities. But that is comparatively rare. Now, this case from the New England Journal of Medicine is, to the best of my knowledge, the first case to prove that an unborn child was infected during pregnancy and actually it died in with the mother. So the story is that a 40-year-old woman started to have fevers, chills, myalgia, and a severe headache at 30 weeks and 3 days of gestation. She had a couple of ultrasound examinations, and there was nothing specific to be found. There was a vaginal bleeding then a couple of days later. And the only thing that they found then on ultrasound is that the child was macrosome. It was too large for the gestational age. Finally, the woman presented again with continuous fever and some vaginal bleeding, and she noticed that the child doesn't move anymore. And at that time, molecular diagnostic testing of maternal blood proved that there was an acute orovirus or Oropuchi virus infection, and testing for other viruses like dengue, Zika, chikungunya, Mayaro, and other diseases that could explain why the child had died in the womb, they were negative. So this is proof of the fact that that the death of the child was due to the Oropuchi virus. The family unfortunately declined a full autopsy, but the infant could be examined with minimally invasive tissue sampling, and this is what was done. And again, the Oropuchi virus RNA was detected in several samples of the child, including cerebrospinal fluid, brain, lungs, liver, umbilical cord, and placenta. So no way around it. This was a vertical transmission of the Oropuchi virus, and now we know for sure this is a dangerous virus, particularly for pregnant women. And this is now in addition to the Zika virus that is present in Brazil and other parts of the world. So it is really something to be aware of if you want to travel there, but it is also relevant for public health officials in the Amazon region. Melvin, any views from your side?
Well, I think the other thing that now needs to be done, if it's at all possible, is to conduct a more comprehensive study on really how often does this happen in that area of the world, right? And maybe also see what are the different outcomes of those who are infected.
Yeah. So this is just the first case, and now clinician researchers are asked to get the details and a little bit more of the statistics behind this. So this is, let me say, proof of concept. It does happen, and now we need to understand more of the epidemiology. I have another piece on a long forgotten disease. It's Legionella. And in this review from Lancet Microbe, they look at recent 2024 Legionella outbreaks. And what they found is they found outbreaks in Australia, 114 cases, 2 fatalities. In Italy, 53 cases, 4 people died. Lincoln, New Hampshire, 7 cases. London, United Kingdom, 30 cases and 2 deaths. Albany, New York, 10 cases, 3 fatalities. Gaston County, North Carolina, 9 cases. Hong Kong, a total of 89 cases, and New Zealand, 108 cases. So why is it important to summarize what we already know, right? Legionnaire's disease is potentially fatal. It does cause outbreaks, but why is it still there? We know all about it. We know how to prevent it, and you don't need a vaccine here, right? You need to make sure that your water is free of Legionella, and we know what to do, how to accomplish this with water heating, for example, and many, many other measures. So the interesting thing about this article is really, why do people not follow instructions of hygiene, right? It is simple hygiene to make sure that people don't get infected with the Legionella pneumophilia. So I think it is interesting, and maybe a reminder for everybody, Legionella is still out there and will be out there as long as there is human life. Melvin, any views from your side or adding?
Yes, it's just a reminder of infection prevention and control, and I don't think we need a vaccine for Legionella.
We don't need, right? It is whom would you want to vaccinate to begin with, and
Exactly.
yeah. And in an outbreak, it is useless because then it's too late, right? You can stop the source, right? You prevent the spread by eliminating the source. That's it, right? So you don't need a vaccine. I have one other piece which is based on a global TBE, tick-borne, not tick-borne, tuberculosis report by WHO 2024. And this is a nice article on this topic. And it is a reminder that after the COVID pandemic, where deaths due to infectious disease and respiratory diseases, the number one was the coronavirus. And now that this is basically not gone, but no longer the number one in mortality, tuberculosis is back. So tuberculosis is back at number one. And like Legionellosis, like Legionnaire's disease, it is a shame because we know what to do to fight tuberculosis, and it is summarized here in the Sustainable Development Goals that I copy-pasted from that article. So this is very clear what needs to be done, and it is not accomplished the way we would like to see this. And very clearly, Mycobacterium tuberculosis is the cause of tuberculosis. But tuberculosis is a disease that is associated with war, with poverty, with crowded living, with social deprivation. And if you stop this, then tuberculosis will disappear. And that's why it is such a shame that we're still looking into big programs to fight tuberculosis. This should be the number one priority for public health officials around the globe, to fight poverty, malnutrition, overcrowding, and these items. I think, and I hope you don't kill me, Melvin. I think vaccine development for tuberculosis is not necessary. If you have early case finding and treatment, you don't need a vaccine. The disease would disappear if you prevent the spread of the disease early on. As soon as the case becomes a source for the infection, then tuberculosis would disappear. We have the means today and we don't do it. It is a shame, I believe. Yeah. But maybe you worked on this when you were with the Gates Foundation, and maybe you have some other insights.
No, Professor, I think really if you want to address tuberculosis, you really have to have a holistic approach that really looks at the socioeconomic root causes. So you have to improve living conditions, strengthen healthcare access, enhance nutrition of these children. They have to be aware, so community awareness, and all these things I think are much, much more important and much more impactful. Really, if you talk about really making this disease a disease of the past, right? So it's really it's sad because TB is both a cause and a consequence of poverty, right? So it's a vicious cycle of poverty and TB.
Yeah. So we are aligned here, and you didn't kill me. So I continue to say that if we would do better with public health, we wouldn't need a tuberculosis vaccine. Let me put it this way, a little bit milder than what I said before. All right, that was our Global Healthcast for today. We covered the COVID spike protein that accumulates in the body and causes long-lasting brain effects. We spoke about COVID, where the infection reduces cancer progression, or there's cancer regression. Melvin brought to you the meta-analysis that links a special EBV lineage with nasopharyngeal cancer. I covered, to the best of my knowledge, the first case of OROV virus to show that it may cause stillbirth. We spoke about global outbreaks of Legionnaire's disease, something that would not be necessary because we know how to fight it. And finally, the turn of tuberculosis, again, a lack of public health, resulting in a bad situation for large parts of the world. Having said this, Melvin, you have a nice funny at the end of our tour for today.
Yes, so this is just something that, is related to the recently celebrated Thanksgiving in the US, right? It's a reminder to be thankful for the journey that you have in life. Don't forget to smell the roses. Don't forget to take some time to appreciate how far you've come.
Carpe diem, as the Latins say, right?
Yep.
Melvin, thank you very much. Thank you to all of you for listening to us today. Melvin, you have the last word.
Yes, so thank you very much, everyone. Stay safe and get your flu vaccine if you're in one of those countries that is celebrating expected to have winter soon.